Good afternoon, members of the press, and welcome to our daily briefing. Fellow Kenyans, our country has been going through a very tough moment following the second wave of this deadly coronavirus disease. This has been the darkest month since March, when the pandemic struck. Since the beginning of this month, we have recorded some 14,927 positive cases. And I remind you that this is only the middle of the month, and lost some 274 people. These are Kenyans from all walks of life: politicians, priests, policemen, teachers, business people, and all sectors of our society have been hit. They are family members, mothers, fathers, brothers, sisters, and our relatives, and we condole them. However, although we have lost so many, we must not forget that we are at a war with an enemy, and like in every war, they are our frontline soldiers. In this war against COVID-19, our frontline soldiers, our health workers, I'm therefore saddened that this virus continues to strike us where it hurts most. That is among our healthcare workers. This month alone, of the 274 dead, 8 are medical doctors. And these are people who have dedicated their lives to save the lives of the majority of us. When one of them loses his or her life, as a country, we are the poorer, in greater pain, because there is a bigger vacuum left and less soldiers to defend us. Once again, on my own behalf, on behalf of the government, I want to pass my sincere condolences to the families and friends of those, including our medical doctors, who have left us and passed on. Fellow Kenyans, in view of the rising numbers of positive cases and deaths from COVID-19, today I convened 2 meetings. One with the Kenya Medical Practitioners, Pharmacists and Dentists Union, and one with the National Emergency Response Committee on coronavirus to deliberate on the emerging issues. And following the meeting with NERC, the committee has resolved as follows. Number 1 is that the County National Emergency Response Committees on COVID-19, co-chaired by governors and county commissioners, should hold emergency meetings and immediately start considering county-specific surgical measures to curtail the spread of the virus in the respective counties. This is in recognition of the fact that the attack rate in the country is different now from county to county, and it may be necessary to take measures within counties that we are not taking in other counties. Number 2, during these meetings, the committees should also assess the county status on oxygen and personal protective equipment for healthcare workers. We have urged that the committees should be responding to the report that has been given by the committee chaired by Eva Jenga on the report on the status of the counties and respond to the shortcomings seen in each county. Number 3, any measures agreed upon must also be consulted, must follow consultations with the Ministry of Health on protocols and guidelines and the Ministry of Interior and coordination of national government for enforcement. Once agreed, the announcement of the measure specific to counties will be announced by the county NAC and specifically the county governor. Noting that the country has adequate stocks of personal protective equipment, county governments are advised to source the same from Kenya Medical Supplies at prevailing market rates. This is in accordance with the agreement between the Ministry, the Council of Governors, and Parliament. In the last few days, there has been concerns about insurance cover, which is the reason the insurance cover and other medical requests that have been made and demands that have been made by the KMPDU. And this morning, in consultation now with the unions, the doctors' unions, we have instructed the National Insurance Hospital Fund to quickly conclude the negotiations for comprehensive group life, last expense, enhanced work and injury benefits, and group personal accident cover for COVID-19 as approved by the Cabinet, and announce the conclusion and effectiveness of those insurance benefits tomorrow. Fellow Kenyans, even as we make all the necessary plans to ensure that our health workers and other Kenyans seeking medical assistance are catered for, we must never forget that containment measures in funerals, in weddings, in burials, and other social functions and gatherings are now being widely abused. We therefore appeal to GAO, the police, and other enforcement agencies, as per instructions by His Excellency the President during the last nation address in vis-a-vis COVID-19 at State House, to implement without any reservations and without any reference strictly the laid down protocols that we have given as far as these areas of gatherings are concerned. I think there was a mistaken notion that it is only the political gatherings that were instructed otherwise.